You can have good products and good technology, but the timing can be off, or a combination of the two. I think, though, the industry is ready, the technology is good to make it happen, and there is fervor from the people looking to get engaged and involved.
That was the voice of Dr. Ash Zenooz, SVP and General Manager for Global Healthcare and Life Sciences at Salesforce. Dr. Zenooz explained why she believes Salesforce is uniquely positioned to drive transformation in the healthcare industry by combining relationship management, integration, and analytics. You're listening to How I Transformed This, presented by Versus 12. Versus 12 is the award-winning Salesforce Gold Consulting partner focused on healthcare innovation nationwide. In our very first episode, our guest, Dr. Zenooz, shares her excitement about the energy and conversation around healthcare transformation in the U.S. today. She offers insight into the ways a connected system can improve patient-provider relationships and explains why that's essential to patient well-being.
If a patient is really engaged and they have really good experience, it really provides better outcomes, and that may not necessarily mean that they live longer, but they live better.
I'm your host, Clark Buckner, and along with Versus 12 founder and CEO Tammy Hawes, each episode we'll be seeking out healthcare technology industry leaders, exploring stories of success through the transformation of healthcare. For more stories like this, be sure to visit versus12.com/podcast. Now, let's jump in.
Hello, my name is Ash Zenooz. I am the General Manager at Salesforce for the Healthcare Life Sciences Industries, and I'm here today in Nashville to talk to the healthcare leaders here. This is such a great city for healthcare. It's a hub of innovation and transformation, and there's really no better place to be, so that's why I'm here.
Well, welcome, Tammy and I. We are so happy to have you in the studio, not only because of who you are, but because this is our first episode on How I Transformed This.
Yes, and I'm extremely happy to have you here because you have such an esteemed career. And for me, being a healthcare technologist, I know it's not just about the technology. You have to know what the healthcare industry does, what the regulations are, what the challenges are, and what the opportunity is. And so I believe that Salesforce is extremely lucky to have you.
Thank you so much. I'm honored to be here.
I love it. How about we begin by just a little framework we like to call past, present, future. We like this because the past gives us a chance to hear more about your story, especially your journey into healthcare and especially how it's led you today at Salesforce. But yeah, let's just kick it off. How did you get started in this? Why did you do this? What's your why?
So I got started in medicine. I'm a radiologist. I do still practice today, and I love medicine. I love the practice of it. I love the people interactions. It's an art and science, and so I really love the practice of medicine. But years ago, my mom was diagnosed with late-stage ovarian cancer, and I transformed into the role of a caregiver. And I had been at these phenomenal institutions practicing all over the country. And it gave me new insights into what it was like from the patient side. And I realized all of the difficulties that patients experience when they're going through a chronic illness. We are one of the leading systems in the world in healthcare, yet I don't think, provide an excellent patient experience or even a good patient experience when somebody's going through this journey. It gave me pause while I realized that I was really enjoying my one-on-one experience with providing care to people. I thought it was important for me to go out and do something at a larger scale. And if a patient is really engaged and they have really good experience, it really provides better outcomes. And that may not necessarily mean that they live longer, but they live better. So that's sort of what led me down this path.
I love that. What a great story. What year was that when you were going from the hands-on care you're practicing? I know you still practice today, but when you were a radiologist, and this was in New York at the time.
No, I was actually in Palo Alto.
Oh.
And this was toward the end of 2010, 2011.
Okay.
And honestly, after my mom passed, so I went through the journey for a while with her. And when she passed, I went through a grieving period, but also a period of exploration personally and professionally. And I applied to be a health policy fellow in DC because I thought that was the best way for me to influence healthcare through policy and legislation. I never really expected to get it. And when I got in, I remember going downstairs, seeing my husband and kids in the living room. And I said to my husband, I was like, hey, you know what? Brookings accepted me into this policy program to go to work in Congress, to work on legislation and healthcare policy. How do you feel about moving to DC? And I never expected that he would say, yeah, let's go do it.
Just instantly. They were all bought in.
I mean, to this day, I'm shocked. But yeah, we uprooted our family and moved down to DC. My husband traveled to come see us, and he was very supportive. So I spent the year in the U.S. Senate as a policy fellow.
Wow.
It was an incredible experience. If people have the opportunity to provide their insight and their expertise, it was such a transformational moment for me to be there.
And they need to hear from more people like you that have been boots on the ground and also have experienced that from the patient side as well.
Absolutely. It's a great way for me to go in and merge together my experiences as, a physician, as a caregiver, and having the background of being in practice. And so you kind of bring those together with policy. I had the incredible opportunity to, for example, sit in the U.S. Committee for Veterans Affairs, work on veterans issues, work on military issues in DOD. I worked for Senator Blumenthal at the time. I also was a nonpartisan subject matter expert on the Aging Committee during the price fixing hearings. So it just gives you an insight into how government works and why it matters that you're engaged in these things instead of just complaining about all the things that are going on around us.
And government is a large part, maybe even a majority of healthcare payment in the country. And so what government does sets the tone, sets the reimbursement, almost sets the trends.
Absolutely. I mean, definitely globally, as we know, government plays such a core and central role in healthcare. I just came back from spending a month visiting different countries in Europe and looking at their healthcare systems as we're looking to have conversations here in this country on healthcare and, what's best and what's the best way to do it. It makes me realize every other country is thinking about the same thing, and they've gone through different approaches, and they do all have different approaches, but I'm not sure if there's any one system that's perfect. I have heard now that there are some that are better than others, and we've talked about longevity, but it's incredible to be living during this time, to see this transformation. The country is ready to have this conversation, and healthcare is ready to transform. So I'm excited.
Well, there's no change without pain, and there's been a lot of pain.
That's right. What is it that they say? Telephones didn't come about by constant improvements in the postcard. So you got to be ready for some changes.
So what about your next step? Where did you go after DC?
So after that, I stayed on in DC. I took a position at the U.S. Department of Veterans Affairs, initially in the Department of Health Administration, VHA, where I was responsible for policy and clinical operations across that vast enterprise. It's such an incredible system. It has close to 1,700 outpatient centers and 170 hospitals, and they're also the largest combined payer provider in the country. So it really gives you an insight into healthcare system at scale.
I would say so.
Yeah. So I spent time there. They take care of 9 million veterans on any given time, but there are 21 million eligible veterans that can get care in the VA. So it's very large scale transformation. But my role evolved into working for the secretary as a chief medical officer, and I was responsible for digital modernization, primarily EHR modernization. And that is a path that led me back to California to do the work I do now.
Can you describe the setting when you were chief medical officer, right? What did you see? What did you experience? What surprised you? And then that can maybe lead us to how you ended up making another big change in your life to where you're at now.
Yeah, absolutely. So what I will tell you is VHA, it's got amazing innovation and hubs of innovation throughout that is probably goes unrecognized at times. It has amazing talent. In fact, the electronic medical record was born in the VA and has taken shape and given where we are today. But I think it was time for change because of all the innovation. There were all these separate EHR versions within the VA. In fact, there were 130 different versions of the single EHR across the VA. There were multiple different disparate systems of record outside of the EHR. And the secretary at that time quickly realized that you really can't have transformation in healthcare without having all of that data coming together and analyzing the data to, look at population health or look at it to have positive outcomes for the population, right? So that's when we started having the conversation of having a lifelong electronic medical record. And that doesn't just start when somebody comes into the VA. It begins when they start their journey in healthcare, which is usually in the military. And as they leave the military and they come into the VA, and, VA, 35% of the care goes outside into the community. So it's not just within the VA. And at DOD, I believe it's 60% of the care during their time in the military goes out. So you really need to have a holistic system that is interoperable to bring all of those records together. And the data has to be good data. So, that was an important part for me. So that was great. But like everything else, change is hard in the system. And so I realized that I had been thinking about change management in my entire career. Of course, my approach had changed throughout my life. When I first started, I thought change management was just sort of coming in and telling folks what to do to change things. 20 years later, I have a different approach where you realize you have to have some core guiding principles, right? It was change management.
Yeah, I think it's so easy as technologists and even healthcare technologists to think that all you have to do is build a solution and people will kind of come to that solution. But if the solution doesn't make it easier and doesn't take into consideration what is actually happening at the point the solution's being used, from an emotional standpoint, from both the patient and the caregiver and, even the back office administration, the technology solution is really useless. And there's so many things in healthcare that aren't as they seem.
I think you're absolutely right. So a couple of thoughts there. I think there's a changing role of the CIO because I think people are recognizing now in healthcare that technology in healthcare is not just a tool. We have to think about it, like you said, from a business transformation perspective. So you have to involve the business side of the house. It's not just implementing things. So again, back to your core principles, for me, it was always about, let's think about what the patient needs and to improve the clinical needs of the patient. And as long as you're centered on that, it's much easier to get buy-in from everybody else around you. And when it's not about something else, like we're going to make this operationally efficient so I think you have to influence change management with that in mind. And with that said, I think you have to think about always involving end users and having them sit at the table as equals to provide input, whether somebody is a receptionist taking in intake forms or a doctor providing care. You always have to have interoperability as a core principle that guides interoperability and safety, I would say, instead of individual point solutions or individual user needs so that you're set up for success. You have to have a clear plan that you communicate with people, and you have to have clear metrics for success, and you have to track it. And what's most important is you have to celebrate small failures because they're lessons learned, and it helps you celebrate the small and big wins. That's sort of like my path, when I was there. It's what I learned and what I've learned over my life. And it really applies to every part of changing things.
And you really have to fail fast so that you can course correct instead of not knowing you failed until 3 years into a huge implementation of something.
Yeah. You have to be accepting of the fact that failure is okay. It's the only way change is going to come about, right?
As you're talking a little about interoperability, so from your perspective as an active practitioner, you've had the patient side perspective, your role as a chief medical officer. How has your view changed about interoperability?
Well, I think interoperability means different things to different people. So, if you talk to a technical person, they're going to tell you about the technical interoperability. But if you talk to a clinical person, to them, interoperability is the ability to exchange information to take care of people. It's like seamless exchange of information. So I think it means different things to different people. But I think overall, like I said, you have to center back on the patient's needs and say, what is it that's required to provide the best care for the patient to provide the best outcomes? And that is a combination of the two. It means to have good, clean data. It means the ability to have clean data that's coming in a structured format that you can ingest, that you can do analytics on. And it means being able to have that data go where the patient needs their care to go easily. So it's not through mailing sheets of paper or faxing things. So we've got to come away from the fax. And everybody talks about the clinical record, but as a radiologist, I'll tell you that in a chronically ill patient, medical imaging is a big component of having that data going and being transferred. People don't want to carry around their CDs of all of their studies. They don't want to carry stacks of paper. So I think we have to think more holistically about interoperability and when we have these conversations, which means you have to bring a lot of different stakeholders to the table.
So, Ash, we've come a long way with electronic medical records, and it's pretty much a given now that, most large providers are going to have an EMR. And we like to say that there's so much in healthcare that should be automated outside of the EMR. Just today, I visited a doctor and they had state-of-the-art clinical technology, imaging, diagnosis technology, everything electronic in the EMR. And as a patient, I still had to fill out all these manual forms, my name in 3 different forms, my date of birth, everything. We're still kind of a long way from the patient experience. What are your thoughts about that?
Absolutely. I mean, this is one of the reasons why I love Salesforce and why I joined Salesforce, right? And so when we talk about patient experience, it's not just your interaction with the doctor and the clinical record. The EHR is great for that, but all of the other administrative processes that happen around there, which is a significant portion of your time spent, whether you're checking in, checking out, receiving a bill, asking for reorder of medications. A lot of these processes happen outside of your 15-minute or 30-minute visit with your physician. And I think when we talk about interoperability, talk about patient experience, we're so focused on the clinical component. But this is the stuff that actually needs to change and matter so that you can alleviate and unburden some of those processes so that the physician isn't concerned about the things that we're just talking about. Salesforce has a unique place and has a unique opportunity to address these changes. They've done this in all of the other industries, and healthcare can really learn from that, right? So look at retail. It's a perfect example, or financial services. I think Salesforce is in a great place because they've done this. They have the ability to take people and processes and companies and bring it together, take disparate systems, disparate processes, and bring it into a single pane, so that you're getting a better experience and a more efficient experience.
I totally agree. That's why I built a business around this.
And we love it.
I love how, Ash, you are a person of action, because we've heard examples of that already. And also, as we're talking about interoperability, I know you were a board member at the Center for Medical Interoperability. I would love to kind of continue this dialogue around how you saw this opportunity at Salesforce and why you decided to make this big shift and kind of what the future looks like.
I think a lot of companies have tried to do things in healthcare for a long time, but I think, you can have good products and good technology, but the timing can be off, or a combination of the two. I think, though, the industry is ready. The technology is good to make it happen. And there is fervor from the people looking to get engaged and involved. They want the Uber-like, retail-like experience when they are dealing with the healthcare system. And so, again, nobody is better positioned to do this than Salesforce. The core principle for Salesforce is customer in the center, improving the experience of the customer and having a 360-degree view of the customer. So for us in healthcare, these customers are people, patients, members. And in life sciences, it is the same, because the lines between healthcare and life science companies are blurring. They're coming together to have care out of the hospital, home care, bringing these processes to have retail experiences. And I think Salesforce is uniquely positioned because we do this across industries. So why not healthcare?
I think so many industry veterans in healthcare, they push back on this whole Uber experience for patients because they think we can't afford it. It won't work. We can't do it. And I think they can't afford not to do it, because the companies that are out there on the leading edge, that are providing these services, making a great patient experience, are going to be the organizations that grow and thrive. What are your thoughts about that?
Yeah, I think, like I said earlier, I think the timing is right. I was at an advisory meeting yesterday with several leaders from healthcare and life sciences sitting around a table, and I noticed that several of the people in the room did not come from healthcare. They either had a retail background or a financial services background. And this was the conversation. And what they said is when they bring up ideas to healthcare folks, a lot of times they hear, no, we can't do that. And they felt like they don't want to do that. But the reality is, like you said, we must and need to do this. And perhaps we don't want to simplify the experience to everybody and say, you're a consumer, because many people don't like that. But to me, being a consumer is empowering. And I saw that from being a caregiver with my mom. You have to have the ability to speak up. You have to have the ability to ask for transparency in your pricing. You have to have the ability to ask for seamless exchange of your records. And you have to have the ability to ask for better outcomes. And you want to know who's providing better outcomes. And consumers have a voice and they have a seat at the table. So the timing is right. And I think we should absolutely empower the patients.
And I think with the patients being empowered, it also allows them to take more responsibility for their own health and help us really transform from becoming a healthcare system of reactive management of sickness to preventative and management of wellness.
Yeah, no, absolutely. There's a lot of discussion in the physician community and, just the general patient community about patients reading things on Google and going into their doctors, whether that's a good or a bad thing. And in my opinion, I think it's a great thing. I'd rather have an informed patient who feels empowered coming in because I know that they're going to be engaged in their care, which probably leads to better adherence and better patient outcomes. So I would support that.
I will confess I have done that. So, Ash, I think in healthcare, from what I've seen in my career, people are uncomfortable with the concept that a patient is a customer or customer relationship management. And I really see the technology being around relationship management, patient relationship management, provider relationship management, even payer relationship management, and all the different constituents that are involved in healthcare, because Salesforce is a relationship management system. And there's no other country in the world that puts so much money into diagnostic equipment and clinical types of point solutions to get to the root of disease and make people well. But if we kind of look into the future, that's still important, but stepping back from it and really treating the patient as a person and having a relationship and all the things that go into that, like the social determinants of healthcare, what's going on with them emotionally, where do they live, what is their family situation, what are their barriers to care. There's not a lot of ways to do that in an EMR system or any other system out there or any other clinical point solution. So speak to your thoughts on that and how that will change in the future.
Yeah, that's so important and it's so crucial. I think they're both very important. I think advancements in technology, advancements in clinical care and outcomes, and advancements in everything around it with the relationship management are all really, really important to optimizing care, delivery, and experience. Salesforce really excels in the relationship management portion, particularly in healthcare. We're so focused on the patient and provider engagement platform, right? And that doesn't just mean engaging your patients or your members. It's also engaging your employees that are working on it and the clinical providers that are engaged in that process to bring everybody into one single ecosystem. Overall, I think our vision at Salesforce is not just to be a system of record or not just to be a CRM or a PRM. It is to be an intelligent system of engagement. And when we first started in 1999, we started off as a sales application. And over the last 20 years, we've really evolved into building a suite of these incredible products that come together to make these great solutions for relationship management. And now over the last year and a half, we've added on MuleSoft to the process to add an integration, which really makes our platform so powerful. We've now been building on our analytics. So to me, it's a trifecta that's perfect, which is relationship management with the integration and the analytics that really make it an intelligent platform for engaging your patients and your members.
The analytics piece of that is huge because there's so much data in healthcare. and with smart analytics to really mine through that data and be able to help bubble up to the top patients that need care immediately and decisions that need to be made quickly. That actually helps providers become, more impactful on their patients.
Yeah, absolutely. I mean, overall, Salesforce is committed to adding more into analytics, and I'm really excited about that in healthcare because of the sheer volume of data that's coming in. So I'm really excited when I hear about them adding in emerging AI technology, blockchain, and other things into this process. Physicians and clinicians and other care providers alone, when they're looking at this data, is amazing, but the human brain is not capable of taking in the large volumes of data that's coming in. But if you bring together the human and the machine, we are just so much more optimized to process this data and provide the care that's needed for our patients. So I'm excited that they're adding in these things. And it's not just the care, right? I forget the exact numbers because it sort of varies, but I think close to a quarter or 30% of our healthcare costs are administrative, and it's administrative waste. And I think with Salesforce adding these features, we could really take a look at some of these processes to make them more efficient, like billing and coding. I believe we spend somewhere around $17 billion on the billing and coding businesses in this country. And if we could bring in and automate some of these processes, it not only reduces the cost and makes it more efficient, but, it'll also reduce the ambiguity that's in place. It'll reduce the legal ramifications that are there and allows the workforce to think of new ways to participate in this. So I'm really excited about what Salesforce is doing here. If you can bring in the right data to actually not just provide local answers, but to look holistically at people, that's the right way to do it. And that's what we're working towards when we're thinking about building patient data models and things into our products.
And it all comes back to the relationship.
And the people and the patients.
What a great point, how we started off talking about people, and here we are again, and it's gone full circle. So as we're starting to wrap up, Tammy, what else do you want to ask Ash here as we have a few minutes left?
I just want to thank Ash for being one of the transformers in healthcare, because it's going to take thinking outside the box and really drive an initiative to manage through proactive change management, which you spoke to in the past. And I'm just so glad that you are one of the healthcare leaders that's moving things forward. Thank you so much for being here.
Thank you so much to both of you for having me on the show.
Thanks for listening to How I Transform This, Success Stories of Transformation in Healthcare, presented by Versus 12. To learn more about how Versus 12 is best situated to transform the healthcare industry and to follow along with this show, be sure to visit versus12.com/podcast. We'll see you next time.